Recently, Governor Nixon proposed Missouri HealthWorks to help small businesses provide health insurance for their employees and ease burdens under the Affordable Care Act. For small employers with fewer than 150 employees, Missouri HealthWorks would pay a portion of employers' health insurance costs for their employees making below 138% of the poverty level, or $27,310 annually for a family of 3. Several other states have similar programs in place to help small businesses. The following is a recording of a webinar on Missouri HealthWorks led by State Budget Director Linda Luebbering. For more information about this proposal or to read the governor's press release on this initiative, please visit governor.mo.gov.
We're going to walk you through a few more details around the proposal that he already laid out. On our first slide, we're calling this proposal Missouri HealthWorks, and it's a health insurance premium assistance for small businesses. Current situation for businesses, as the governor indicated, there are many requirements with the Affordable Care Act that businesses must comply with. Some businesses are looking at penalties if they don't offer health care coverage, or even if they do, if it's not the right kind of coverage or if it's not affordable for their employees. And of course, small businesses attempting to attract employees would like to offer health care, but you don't always have the opportunity because of the cost. In Missouri, as in all states, businesses are paying federal taxes, but over half of the states are actually reforming and expanding Medicaid, and so they're bringing those taxes back home. We're not doing that in Missouri right now. Health insurance requirements can be especially challenging for businesses that rely on lower wage workers, and those are just the type of workers that could be helped through this proposal. Interesting study done by the National Federation of Independent Businesses, and this has been true for 25 years. The number one concern of small businesses is the cost of health insurance. That's been consistent for a long time. 52% of small businesses responded that it was a critical concern for them. The opportunity, Governor laid this out, Missouri HealthWorks. What this would do is use federal dollars to help pay a portion of the employer's cost of health care premiums. It would be focused on businesses with fewer than 150 employees, so small businesses, and it would be focused on employees with incomes up to 138% of the federal poverty level. It would help businesses, though, beyond that, because if you can make insurance affordable for your lower income workers, obviously that helps you provide insurance for your entire workforce. In Missouri, that 138% of the federal poverty level is $27,310 annually for a family of 3. If one person in the family is working 40 hours a week at $13 an hour. So people up to that level could be included. This map shows you the percentage of employees who work in firms with fewer than 150 employees. So you can see we're talking about something that could have a significant impact because a lot of employees do work in small businesses, businesses less than 150. How it would work, we would use federal dollars, as we do now, to help pay for health insurance for low-income working adults, but we'd use those dollars in a more cost-efficient, smarter way by helping small businesses, those with fewer than 150 employees, pay the cost of premiums. And we would make that then be a less expensive option for employers. We'd help you cover your costs. The way we're proposing it, we could have local chambers assisting those local businesses if they chose to sign up for this program, working with Department of Economic Development, so a department that you already have regular contact with. Those employees of any business that chose to go this route would be required to take this more cost-effective private option rather than enrolling in traditional Medicaid. A couple of the other points around this program, the program has to be cost-effective for the federal and state government. So what we look at there is what it would cost the state and federal government to provide these types of services through the regular Medicaid program, and then compare that to what it would cost to provide the same health care benefits through the employer's plan. We believe that we could cover 60% of the cost of the premium using those federal and state dollars. And it's possible that if we had to go below that, it would still be a good deal for small businesses, because obviously we'd be helping you cover a portion of the cost that you're now covering entirely on your own. Employees would be required to share in the cost. Because of the rules around this program, that would be set at 15% of the cost, or no more than 2% of income for those below 100% of the federal poverty level, and again 15% or 5%, whichever's less, of income for those from 100 to 138% of the federal poverty level. Here's more specifically, you can see some numbers here on a hypothetical example of how this would work. So if you had a health care program, health insurance program that cost you monthly $400 per employee, right now you would be hypothetically covering $300 of that at the employer expense, $100 at the employee, and obviously the federal and state would not be kicking in anything right now for that program. But if we expanded the reforms and expanded Medicaid here in Missouri, we could offer for that very same employee and employer, where the employer's cost would drop to $100, so a $200 cheaper per month employee would drop to $30, and then the federal and state government would pick up $270. Another example just below that, basically the same current facts. The only slight difference here is this is an employee who makes above 100% of the federal poverty level, so we would be able to have that employee cover a little bit more of the cost, so they'd be kicking in $60 in this example, and the federal state share would drop to $240. State participation, this has actually been an option available to states for a long time. It is simply that the opportunity to reform and expand Medicaid makes the option more viable for states, for businesses, for everybody all around. A couple of other points: the penalties that businesses are facing because of the Affordable Care Act make the timing on this more critical. So it's become more critical to think about this option. And then finally, federal resources are now available that will help us pay for this program. Quite frankly, it probably wasn't economically feasible for the state of Missouri before the Affordable Care Act, but now it is. There are lots of states that have similar programs, not identical, but similar. You can see some of them there. We've just picked out a few: Arkansas, Iowa, Kentucky, etc. Iowa requires the use of employer insurance if available, so that's something Iowa's doing that's a little bit different. You can see Maryland and Oklahoma pay some of the employer cost. But again, this is just a short list. There are many other states that have similar but not identical programs. The benefits of this program are pretty clear. Number one, it reduces business cost. It makes it cheaper for you to provide health care to your employees. It encourages low-income Missourians to work because they would no longer be at risk of losing their Medicaid coverage if they went to work. Right now, we have so low level of coverage for Medicaid that it's sometimes better for people not to take jobs. This proposal would encourage people to take jobs. It does include cost-sharing requirements. That's a good thing. We think employees having some skin in the game, so to speak, is a good thing. Reduces employee sick days. Obviously, if they have access to doctors, they're going to be able to stay well and be able to work and not miss work. Other benefits, the federal government, because of the Affordable Care Act, would pay 100% of the state federal share to start with. Gradually, that steps down to 90%. But from that point forward, it stays at that 90%. So federal dollars covering 90% of the federal state share of the cost. It would help businesses who would be subject to penalties to avoid those penalties. It would require employees to use this more cost-efficient health care rather than traditional Medicaid, and reduces the number of uninsured. This map kind of gives you the standing by county of the uninsured Missourians. You can see we range as high as 34% of Missourians don't have access to health insurance. And you can see it is somewhat more likely in rural areas, plus obviously St. Louis City, but certainly high uninsured rates in some of the rural areas of the state. What needs to happen? Pretty straightforward. The state legislature needs to move forward on reforming and expanding Medicaid. So they need to pass legislation that would authorize increasing Medicaid eligibility to 138% of the federal poverty level. They need to authorize this health insurance premium assistance for small businesses. That would be part of the same bill. And then once that happened, we would need small businesses to participate. Local chamber involvement. We'd like to, at a minimum, have local chambers help us explain this program. Whether the chambers chose to be more involved would obviously be up to them. How can we accomplish? I think the best thing is to continue where we are with the efforts that have been made so far. 75 business groups in Missouri have already endorsed Medicaid expansion, and that really has kept the pressure up, the focus up, the discussion up. We just need that to continue. Support from small businesses and local chambers. Continue talking to your legislators. Let them know you're still watching. Let them know you still want this to happen. And then obviously we would need help explaining the opportunity to local small business owners, to explain to them how the program would work and how to sign up, etc.